I'm Dr. Mike Litrel, a gynecologist at Cherokee Women's Health Specialist in the greater Atlanta area and a clinical assistant professor at Emory University. In this video, I'll be highlighting an exciting new surgical technology that I've incorporated into my practice. The AirSeal system represents a revolutionary change, creating and maintaining pneumoperitoneum in a way that is very different from conventional insufflation and trocar technology. AirSeal prevents both hazardous drops and spikes in intra-abdominal pressure and provides automatic and continuous smoke evacuation throughout the entire surgical procedure. This enables the surgeon to have a clear and constant operative space, giving the surgeon complete confidence in any laparoscopic procedure. The AirSeal system is comprised of three main components. The first one is the IFS, or Intelligent Flow System. This is a specialized insufflation evacuation unit. The second one is the tri-lumen tube set, which allows for real-time pressure sensing, bidirectional flow, and continuous smoke evacuation. The third is the access port, which enables valve-free access to the abdominal cavity and serves as automatic pressure relief valve to prevent intra-abdominal pressure spikes. I've been using AirSeal for 6 months. What this has done for my laparoscopic cases is it's allowed me to keep perfect visualization. It's evacuated smoke, and it's allowed me to maintain stable pneumoperitoneum. The most frustrating thing to a surgeon is losing the ability to see what you're doing. And this, before I used AirSeal, this would happen all the time. A trocar would slip, we'd come to a point where we amputate tissue, and we would lose the ability to see. What AirSeal does is it provides a constant measure to the pressure. So instantaneously, the pressure is being measured and it's being maintained at your set level, whether it's 15 or 14 or 13, whatever level is that you choose. To illustrate what this means, it would be like if you took someone's blood pressure and you had a cuff around their arm, you took their blood pressure every 3 minutes, that would be giving you an idea where the blood pressure was. Whereas if you had an arterial line in the radial artery, you'd be measuring the pressure constantly. That's what this device is. So what you have, what the laparoscopic surgeon has, is they have a device that's providing a constant pneumoperitoneum into the patient's abdomen that will not fluctuate, that does not give the big fluctuations with traditional technology. Until the introduction of AirSeal, insufflation technology has not had any improvements in 40 years. So although our scopes have improved dramatically, have gone to digital scopes, have gone to smaller digital scopes, our monitors have gotten better, the way we insufflate our patients has not gotten better. So what I'm learning as I'm using this device is I'm learning more and more about the consequences of having inferior insufflation technology. When surgery is going well, it goes faster. As simple as that. When you can see what you're doing, your operation proceeds faster and safer. So this is clearly a big time saver. There's no struggle to suck smoke away. There's no struggle to re-insufflate the patient's abdomen. There's no struggle to replace trocars that are leaking. So what happens with our patients postoperatively that's very common is that patients will experience severe shoulder pain after the surgery. And unlike the incisional pain, the shoulder pain doesn't get better even with narcotics. Patients just have to walk it off and spend a few days, and they'll come back to my office 2 weeks later and say, boy, that was miserable. And I'll make every effort in the world to get every bit of gas out, okay? The thing that I've noticed since I've been using AirSeal is that this post-operative diaphragmatic irritation, shoulder pain, is less prevalent. And I think that there's two reasons for that. One is that I'm not having the spikes of carbon dioxide pressure that I had with traditional insufflation. And the other is that when you turn the machine off, all the gas is removed. And it's done much better than just leaving ports open and pressing on the patient's abdomen or even sucking it out. It's done very gradually, and the pressure goes down to 0.